Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can help. Good evening. Today is Thursday, April 2nd. As of Wednesday evening, the CDC reports 213,144 confirmed cases and 4,500 deaths in the United States. This represents a 15% increase in cases and 25% increase in deaths from the previous day. The case fatality rate is 2.12%. Although the case fatality rate has been rising incrementally over the past week, this may be due to the fact that milder cases are being instructed to forego testing and self-isolate at home. We promise at the end of the podcast today we're going to have some good news for you as well. But as of this afternoon, Worldometer reports 228,727 cases in the United States, 5,373 deaths in the United States, and we've passed the 1 million mark as far as worldwide cases.
And I think that represents now we're double the next highest country in terms of number of cases, right? I think we're double Italy now.
We have a large population, and we are starting to test a little more. So it is a big number, but we also are a very spread out country, so that's a very uneven number as well. And we'll talk about that specifically when we get to the U.S. news. But in global updates, data from the Financial Times shows that the daily death tolls are beginning to plateau in Italy and Spain. In the United Kingdom and the United States, however, the number of deaths per day continues to rise rapidly. In terms of confirmed cases, the U.S. is the only country in the world to have surpassed 200,000 cases. In U.S. news this morning, Governor Cuomo reported that New York State has only 6 days' worth of ventilators left. There were 432 deaths in the state in the past day alone. 81,000 healthcare workers have volunteered to help in New York's hospitals, including 21,000 people from out of state, which is really incredible. With the ventilator issue, we will talk about that a little bit on a podcast tomorrow morning. There are a lot of incredible solutions that people are coming up with that make us very hopeful that we'll be able to solve that problem. Following mounting pressure, the governor of Florida finally issued a statewide stay-at-home yesterday evening, but it is excluding church services from the order. Experts have been particularly concerned about the rise in cases in Florida due to the spring break-related tourism and its largely elderly population. Over a quarter of the state's population is over the age of 60. 12 states in the U.S. remain without any statewide orders as of the time of this recording, including Texas, which shares a border with Louisiana, and at more than 4,000 cases is beginning to see a surge in cases as well.
On March 31st, NPR reported that the director of the CDC stated the current data shows 25% of COVID-19 cases may be asymptomatic, leading to concerns of further spread of the outbreak by such carriers, particularly in 12 states that have not issued stay-at-home orders yet. New York Times on April the 2nd reported an analysis of anonymous geographical cell phone data and found that people in the Southeast and places that delayed issuing stay-at-home orders continued to travel wildly, potentially exposing entire communities and accelerating the outbreak. In contrast, Americans in the West, Northeast, and Midwest have largely complied with stay-at-home orders, traveling on average less than 1 to 5 miles from their homes. Experts credit these early orders with slowing down the outbreak on the West Coast, even in populous areas like California. On April 1st, the FDA announced that it has approved the first test for coronavirus antibodies in the United States, which can show if a person has ever been exposed to the virus and thus may have immunity. Yale New Haven Hospital has been authorized to perform the PCR test. Similar antibody tests are already being used in other countries, including China. On April the 1st, it was reported on a educational emergency medicine website called Rebel EM that putting a patient in prone position prior to intubation can actually help reduce the need for intubation and potentially save the patient an intubation and the need of a ventilator. I have heard on multiple occasions this being performed to help delay intubation. Interesting, I have not heard of many cases of actually preventing intubation, but it's certainly a possibility. What happens is when you put a patient prone, meaning they're face down, you can improve the oxygenation in their lungs. So we actually, one of the members of our team recently received a text from an old ER colleague picturing a young patient with oxygen saturations around 54% and a elevated heart rate who responded really well to just putting them in a prone position. So it does raise the possibility that this could be a nice, easy intervention for some of these patients to improve their oxygenation and I guess maybe decrease the likelihood that they're going to require intubation.
And even if it doesn't decrease the actual intubation rates, if it does delay it, right now with flattening the curve, that is potentially a win as well. Any delay tends to be a win in our current situation, whether it's a delay of a hospitalization or a delay of an intubation or a delay of an ICU, as long as it doesn't have a negative outcome on the patient in general. But the more we're able to delay certain things and then get other patients discharged and free up the space, the better.
There was an interesting article on nature.com today regarding the likelihood that COVID-19 can be spread via aerosol as well as droplets. So they go through some of the research suggesting that aerosols contain viable particles to cause infection. This has been a big topic of debate. We talked about it a little bit on our podcast that we released this morning about masks. I also published a DIY video on how to make a mask out of a shop towel on our Instagram account. That's Wild Health MD today. I did that due to all of the questions that we got about how to make a mask if you can't sew and if you don't want to purchase masks because you don't want to take them away from healthcare workers. So that's just a quick video you can watch on how to make a disposable mask from a shop towel.
And if you want some more ideas of how to make homemade masks, the website covidskunkworks.com, who we interviewed today, will be releasing tomorrow morning. They have some options for making homemade masks as well.
Another article published in JAMA on March 31st discusses community prevalence of SARS-CoV-2 among people with influenza-like illness presenting to a Los Angeles Medical Center in March. They found that 5% of mild flu-like symptoms actually tested positive for COVID-19 in this Los Angeles study. The reason that's concerning is because these are patients who are able to walk about the community, go about their daily lives. They have mild flu-like symptoms. It's not keeping them stuck in bed. They're not, unable to get up and get out. They can go to the grocery store. They can do all of these things. And this raises the concern of easier transmission of the virus if so many people can have such mild symptoms, basically. In another study published on JAMA Network, they discuss a case series and reported a cluster spreading event in China. This was actually 700 kilometers northeast of Wuhan, where a single patient transmitted the virus to 8 other healthy individuals through a hot public bath. This is probably just published because it discusses the fact that the virus is still transmissible in a hot and humid environment, suggesting viral transmission is not weakened by these conditions. I want to be careful here. This is an extremely small study. It's a single case of transmission to 8 people, and it doesn't really tell us anything true about the R value itself of the virus, the R value being the transmissibility. There's been multiple studies suggesting that we're likely to see a reduction in the transmissibility of the virus when the temperature warms up and humidity increases. And I, for one, am crossing my fingers for that and not paying too much attention to this single case series.
And let's end with some positive, less depressing news than the rising numbers that we always start out reading. I stole this directly from Dr. David Sinclair. He sent a great email out yesterday that if you're not getting, you should sign up for at lifespanbook.com. Or you can join our virtual summit this weekend and ask him questions. He's our first guest this weekend on Saturday. You can register for that at Wild Health Summit for free. So from his newsletter, there are 57 drug and 39 vaccine trials underway. In the past 2 days, the number of new COVID-19 cases in U.S. states have finally started to slow. The number of people moving around is down about 80%, according to Wrist BioTracker and vehicle GPS data. So no matter how many images you see of people spring break partying at the beach, in general, people are doing a pretty good job, which is great. The number of people with fevers has declined below seasonal levels, according to Bluetooth thermometer company Kinsa. The FDA has approved the use of both hydroxychloroquine and plasma from recovered patients, which is kind of light speed for an FDA approval. Stress tests on the banks show much greater health than in 2008. Scientists, journalists, programmers, and governments have created a valuable body of work to inform us where we currently stand. So those are all good news, and I think it's important that we stress those as well. So tomorrow morning, we're going to be releasing a podcast with the COVID Skunkworks team. It's a team of about 250 engineers, doctors, and other specialists who are making a tremendous difference. And we're discussing exactly what you can do to help as well. Of course, it doesn't apply to everybody. It only applies to you if you're a specific population, which would be a human being living on planet Earth. But in all seriousness, just hearing about what this group is doing with their expertise and ingenuity made me extremely hopeful. We've got really good people working on this problem.
Yeah, that's really encouraging, Matt. I mean, it's hard. I think we talked about this on our last update, or maybe it was the day before, that all the days seem like they're running together, but I'm just continually amazed by how much work is being done on this pandemic. I mean, obviously it's all of humanity coming together, and I think that we're going to see some amazing engineering. We're going to see some amazing science come out of this whole tragedy. And we've seen that previously in war, and we're at war right now. The human race is at war against a virus, and it's honestly great to see us coming together like this.
Yeah, we have a shortage, and that's what's in the news, a shortage of PPE and the shortage of certain supplies. But talking to somebody like Brad from their team today made me realize that while we may have a shortage of some resources, we have an incredible abundance and excess of human ingenuity right now, and it's all being pointed towards this. So it really made me hopeful, and hopefully it'll be a hopeful podcast for everyone tomorrow morning as well.
All right. Thanks, Matt. Talk to you tomorrow. Thanks so much for listening to this COVID-19 update. Please send us your questions or follow along on Instagram and Facebook at Wild Health MD. And just to be clear, this is not medical advice. No patient-physician relationship has been established, and this resource is really for general informational purposes only. And finally, if you want to spread the word, please send this podcast to friends and family and give us a review on iTunes. Thanks again, and stay safe.